For decades, the medical community accepted the fact that testosterone replacement therapy, or TRT, should never be prescribed for aging men due to the increased risk of prostate cancer. This was especially true for men that were diagnosed with the dreaded disease. It was considered by many urologists that treating men suffering from prostate cancer with testosterone would be like throwing gasoline on a raging bonfire. However, this long-held view has been challenged. A recent study produced evidence that testosterone replacement therapy, or TRT, significantly improved outcomes for some men who underwent robot-assisted radical prostatectomy, or RARP. The finding is the conclusion of the study of 824 patients who underwent RARP for the primary treatment of prostate cancer. A subset of patients, N equals 152 or 18%, who had reduced preoperative levels of free testosterone was given TRT for postoperative recovery of sexual ability. As an unexpected finding to the researchers, the results showed that this study group of patients had many fewer biochemical reoccurrences within a year of surgery. Also, TRT use was associated with a longer time to recurrence and delayed disease progression compared with traditional treatment, reported Maxwell Toe, B.S., a clinical research fellow at the University of California, UC Irvine. The findings refute entirely the rigid belief, dating to the 1940s, that states, quote, "Thou shalt not give testosterone to men with prostate cancer," end quote. The concern has been that testosterone will promote the growth of prostate cancer cells. As a result, typical treatment was designed to lower testosterone levels with chemical castration, using androgen deprivation therapy, or ADT. Quote, "It's very hard to overturn guidelines and black box warnings on drugs, but I think this research is important for doing just that. We need to expand the growing body of evidence that testosterone replacement is safe and possibly beneficial for these patients," end quote. Toe said in an interview with Medscape Medical News. Asked to comment, Francesco Montorsi, MD, director of the urology unit at San Raffaele Hospital in Milan, Italy, who was not involved in the study, said these surprising conclusions, quote, "emphasize the importance of checking testosterone levels as a part of the management of patients with sexual disorders following radical prostatectomy," end quote. Quote, "Obviously, selection of the right patients is vital, but if confirmed, this may have immediate benefits on quality of life," end quote, Montorsi told Medscape Medical News. Quote, "The possibility of reducing mortality would be an unexpected bonus," end quote. The new data was presented here at the European Association of Urology, EAU, 2019 Congress. In an interview conducted before the meeting, senior author Thomas Allering, MD, professor and vice chair of urology at UC Irvine, explained the rationale for the study to Medscape Medical News. Quote, "The whole thing actually started because, of the men that I was seeing, enough of them were not having recovery of sexual function. I did the same operation. Why were these guys not doing as well? That's what prompted me to start measuring total and free testosterone back in 2009 on everybody," end quote, he said. Allering stressed that free testosterone is the bioactive form of the hormone. He and his colleagues found that a low level of free testosterone is a separate risk factor for high-grade prostate cancer. Quote, "We saw this really clear situation where, as the testosterone levels continued to drop, the grade group in particular, started to go up. So the lower your testosterone, the more aggressive your cancer was," end quote, he said. The beginning of the, quote, "testosterone causes prostate cancer," end quote, myth. Concerns that giving testosterone to men with prostate cancer is like pouring gasoline on a raging fire date back to the work of Charles B. Huggins, MD, a pioneer of hormonal therapy for prostate cancer and co-winner of the 1941 Nobel Prize for Physiology or Medicine. However, recently, Allering and his team and other independent investigators uncovered evidence that suggests that for some men, particularly those who have low testosterone levels at the time of surgery and who have low-risk disease, TRT may be both safe and effective because it promotes muscle mass, improves lipid profiles, and increases libido and sexual performance. Quote, "This seems to be a win-win," end quote, Allering said. The study details. The study consisted of 824 patients who underwent RARP as the primary treatment of prostate cancer. For all patients, testosterone and sex hormone binding globulin, SHBG, levels were measured before the operation. Free testosterone levels were calculated likely. For almost 1/5 of these men, N equals 152, 18%, preoperative levels of free testosterone were low. These patients started a regimen of TRT to speed up post-operative recovery of sexual function. Patients stayed on TRT throughout follow-up or until the time of biochemical recurrence. The patients who received TRT were proportionately compared to 419 control patients from the same study by pathologic Gleason grade group N stage. After a median follow-up of 3.1 years, TRT was linked with a 53% relative reduction in risk for biochemical recurrence, which Allering stated was, quote, a big surprise, end quote. In addition, in a secondary analysis of time to biochemical recurrence, TRT prolonged the time to recurrence by a median of 1.5 years. P equals 0.005. In a variable analysis that considered pathologic grade, stage, preoperative, postoperative specific antigen level, and free testosterone level, the investigations concluded that TRT was an independent predictor of reduced risk for biochemical recurrence. Quote, our hope is to get this to a randomized clinical trial so that we can efficiently test this hypothesis that testosterone replacement therapy will help these men who have prostate cancer, end quote. Toe told Medscape Medical News. In another study also presented at EAU 2019, Toe and colleagues determined that patients with free testosterone levels in the lowest quartile, 4.42 nanograms per deciliter, had a higher percentage of Gleason grade group 5 disease, 15.6%, than patients in the highest quartile, 6.96 nanograms per deciliter, 6.2%, P equals 0.002. A urologic surgeon not involved in the study told Medscape Medical News that the findings are similar to those found in his patients. Quote, we also observed that patients with hypogonadal status have worse cancer prognosis because they have high-grade cancers, and also, prospectively, we showed that patients who have worse prognosis have a more biochemical recurrence, end quote, said Jan Noiselet, MD, from the Hospital Foch in Cheresny, France. Noiselet told Medscape Medical News that when his group planned a study of TRT similar to that of Allering's group, the monitoring committee objected on ethical grounds. The study was internally funded. Toe, Allering, Noiselet, and Montorsi have disclosed no relevant financial relationships. European Association of Urology, EAU, 2019, Congress, Abstract 646, presented March 17, 2019. The effects of testosterone replacement therapy on the prostate, a clinical perspective. Overestimating the significance of these findings is hard. The complicated relationship between testosterone and prostate cancer has still not been conclusively settled. As with so many medical issues, more research is needed. However, these results should cause a reevaluation of the Testosterone/Prostate Cancer Association. Contact our clinic for a detailed discussion concerning what testosterone and growth hormone replacement therapy can do for you.